This lady is 32-year-old female. She did deadlift in the gym, and while doing the deadlift, she felt a pop sound, and then immediately she collapsed on the floor. She could not move an inch, and she had to be literally carried to our hospital by their caretakers. Upon investigations, we understood that she has got her back injured, and we asked her to take rest and gave some medications. Literally, it took almost 1 month for her to get rid of the pain, and even now, the pain is only 80% improved. Still, she's got morning stiffness, and then she was unable to sit for a long time. Being an software engineer, and she had to sit for her job, she was very worried, and she wanted to know what's happening in her back. So, she wanted to get an MRI done, and this MRI was done 1 month post injury. I will use this MRI as an opportunity to teach you how to read the MRI images as well. What you see is the T2 weighted image. That's why the CSF and the nucleus pulposus is looking bright. That's the typical of T2 weighted image. Here is the disc between L5 and S1, which is protruded posteriorly, wherein if you see the other disc like L4, L5 disc and L3, L4 disc, the disc in the higher level are in pristine shape. They don't have any bulge, they don't have any degeneration because it's looking white. If it looks very white in appearance, you can understand that the nucleus pulposus is intact. What you see in the lower level is the nucleus pulposus is degenerated. That's why it lost the whitish appearance, rather it looks dark. The darkness or the blackishness of the disc indicates that it is degeneration. You may argue that it is age related degeneration. It is not, because the patient is only 32 years old, and if you could see, there is an age symmetrical degeneration. If you see an old man's MRI, there will be a diffuse degeneration in multiple level. Here the patient is having specific degeneration only in the L5S1 level. That indicates that the degeneration is not age related, it's more of load related, mechanical related, or possibly the injury related as well. Here is an axial view of the same level. This is the L5S1 level axial view. This is the disc over here, and here is the protrusion what you see here. So the normal MRI looks like this, wherein the disc will not disturb. This is an example of normal MRI where the disc is having a safe distance between itself and the nerves over here. But as you come down at the lower lumbar level, specifically at L5S1, there is a protrusion happening here, and in this level it's very significant disc protrusion which is compressing the thecal sac. So based on the MRI, it's fairly agreeable that the patient's pain is coming from disc. The patient was having early morning stiffness, unable to bend forward, turning in the bed was painful, coughing and sneezing is producing painful, SLR was positive. So these are all the clinical signs that we use to ascertain that the pain is discogenic in origin. So indeed this patient is having pain coming from the disc. Though the patient has improved with 1 month of bed rest and medications, she want to know the reason for the pain. She asked me two questions. First question, did the deadlift cause the disc protrusion? I don't think so, because what you see as the degeneration over here, it's not going to happen overnight. Any sort of degeneration is a gradual process. Easily this degeneration would have taken 5 to 7 years to happen. Most of the degenerations would not cause pain until it starts to inflame, and you know that the degenerated disc is the disc which is unhealthy disc. Yeah, the disc over above in the L4 L5 level, you could see the disc space is intact, the nucleus pulposus is intact, there is no breaching happening here because it's a healthy disc. Wherein the degenerated disc over here, it's unhealthy disc, so it will give up very easily. It's something like, no, the old car tire can puncture pretty frequently than the new car tire. That means what? When there's a degeneration happening, the disc becomes vulnerable, and you could see some amount of nucleus pulposus is trying to come out, and then this will cause severe inflammatory reaction at the spinal canal level that causes neurogenic pain. Sometimes this pain can even travel down to the leg. Fortunately for this patient, since the disc bulge is exactly in the center, there is no much exiting nerve compression, or in other words, there is no sciatica type of symptoms, because as you could see, there is a nerve here, which is exiting out of the spinal canal at L5S1 level, which is not getting compressed. Rather, the nerves over here in the central canal and the dural sac was getting compressed. That causes an inflammatory reaction over here, and this inflammation causes severe pain in the lower back. So this patient was having central low back pain due to the posterior disc protrusion. So to answer her question whether deadlift caused her the disc protrusion, it is not caused degeneration. Deadlift would have caused further protrusion of whatever protrusion was previously present, and that further protrusion would have caused inflammation, but I don't think that the degeneration would have caused due to the deadlift. I don't think the degeneration would happen due to deadlift, because degeneration is a gradual process. So this disc was waiting for an opportunity to express, and deadlift could be one of the trigger. So remember, there is something called predisposition and something called trigger. Here the degeneration of the disc is a predisposition and the deadlift is a trigger. So don't blame the trigger, always consider the predisposition, and that is the root cause of the problem. When you treat the patients, you need to clearly make the patient understand what is predisposition, what is the trigger, so that they can look after themselves without any second episode. This patient also asked me one more question, whether she can do deadlift again in her life or not. My answer here is both yes and no, because firstly, the current episode should get abolished completely. She should become absolutely pain free. She should allow it to heal, and then once the disc fully heals, it will create a layer of scaffolding around it, so that it will not further protrude. As long as it doesn't further protrude, the inflammation ceases, and with a safe form, with a proper pacing, periodization, she can try do the deadlift again. But again, it always comes with a risk, so it's all about risk benefit ratio. Since this patient is also a software engineer, she may be having to sit for a long time in the office. So sitting for a long time in the office and then coming to the gym and doing deadlift, they are not a good combination. Of course, this patient can do that with so many terms and conditions. So we have been currently treating her. At some point of time, we'll be able to completely get rid of her pain. Then we may think of allowing her to do a deadlift. It's because the patient wants to do it. So as a therapist, we need to fulfill the patient's needs, fulfill the patient's expectations, at the same time treating the biology. All right. So I hope you understood certain things today about deadlift and low back pain. I'll see you again in one more video. Thank you.